Hello everyone, my name is Rachel Warner and I work for the Nevada State Immunization Program as the School and Childcare Immunization Coordinator. I've put together a training to go over the annual Childcare Immunization Survey that NSIP asks all of the childcare facilities in Nevada to complete. And this slide here shows the Nevada Division of Public and Behavioral Health's mission, vision, and purpose. So we'll just take a quick look at that. So here's a quick agenda of what we'll be discussing during today's training. First, we will review the Nevada Childcare Immunization Requirements so that everyone is up to speed and comfortable with that. We'll then talk about what the state asks childcare facilities to report on each fall. And then we'll talk about why the state collects those childcare immunization rates. And then finally, we will go through the Childcare Survey questions in a bit more detail so that everyone's comfortable once they start taking the survey. There are immunization requirements in place in each state for children to enroll in a child care facility. Nevada specifically has these requirements outlined in Nevada Revised Statute, NRS 432A.235. If you are interested in reviewing this regulation in a bit more detail, it will be accessible via the resources I sent out with this training. Vaccines are required by specific age groups when children are enrolling in a child care facility. At 6 months of age, hepatitis B and polio are required. At 12 months of age, Hib, PCV13, which is pneumococcal, MMR, varicella, and hepatitis A are required. At 15 months of age, DTaP is required. At 18 months of age, another dose of hepatitis A is required. And at 4 years old, additional doses of DTaP, polio, MMR, and varicella are required for childcare entry. It's important to note that children being admitted to a childcare or accommodation facility in Nevada need to receive all of the required vaccines at the youngest recommended age per the recommendation of the Centers for Disease Control and Prevention and the Advisory Committee on Immunization Practices, or ACIP. We'll view this in a little more detail in the next slide. There are also different requirements for children enrolling in a Nevada school, but for the purpose of this training, we'll just be focusing on childcare immunization requirements. And here on this slide is the childcare vaccine schedule graphic. This chart shows the vaccines required at the various ages, which dose number, and the age required for childcare entry. Again, children need to receive these vaccines at the youngest recommended age, which is the age shown on the far right of the chart here. There is a 30-day allowance for all of these vaccines, so for instance, if we take a look at the first row, as long as a child received their third dose of the Hep B vaccine between 6 months old and 6 months and 30 days old, that would still be considered valid for childcare entry. And the same will be true for all vaccines on this chart. As a little bit of background, we ask childcare facilities to report on their enrollment numbers, up-to-date vaccine rates for children ages 6 months through 4 years old, number of religious and medical exemptions, and children who are conditionally enrolled. We ask for this information to be submitted every year. The surveys open up in September or October, and they close at the end of the year on December 31st. For the past few years, this has been in the form of a survey through an online program called REDCap. And we are still using REDCap, but we've worked on updating the childcare rate reporting survey to make it a little easier for the childcare directors or administrators who fill it out to respond to the survey questions. One reason that we collect childcare immunization rates is so that we have an idea of how individual counties and childcare facilities are doing with vaccine rates. And next year, we intend to create childcare vaccine report cards for each county. We did this with the schools in Nevada this year, and we included all of the up-to-date vaccine numbers and also included data on exemptions, conditionally enrolled students, and non-compliant students. For the childcare report cards for next year, we'll plan to send them to our contacts at Childcare Licensing so that they can get them out to all of the childcare facilities here in Nevada. Additionally, in the case of a vaccine-preventable disease outbreak, it's also important to know which facilities may have higher rates of religious exemptions and lower up-to-date vaccine rates overall. Say, for instance, we see a measles or a pertussis outbreak somewhere in Nevada. If this were to happen, we would identify the childcare facilities that are more at risk, and they would identify the children who aren't up to date on certain vaccines and exclude them until the outbreak is over. So before I dive into the actual survey questions, I want to cover some common immunization rate reporting definitions that we encounter a lot here at NSIP, and especially in the school and childcare vaccines world. I'll be using these terms more frequently throughout this training. First, up-to-date, or UTD, means that students have all of the doses of the required vaccines for school or childcare entry. We would not include students with an exemption or who are considered behind on their immunizations when we report these up-to-date numbers. These students are considered in compliance. Conditional enrollment, or sometimes known as provisional enrollment in other states, means that the child is not currently up to date on all of their vaccines, but they are in the process of completing the series of shots. This may be because the student was behind on their vaccines and is completing a catch-up schedule. This happens sometimes when the student just moved from another state or another country with maybe certain different vaccine requirements. So as long as the student can show proof that they are in series to get their vaccine or vaccines complete, the childcare facility has to accept that, and the student shouldn't be excluded from the childcare facility. They are given 90 days to complete the series and to be considered conditionally enrolled. One other term we often see is non-compliant. This means that the student is not up to date on their vaccines, they aren't considered conditional, and they don't have any medical or religious exemptions on file. When a student is considered non-compliant, they should be excluded from the child care facility and can only return when they get vaccinated or file an exemption. Okay, so now that we've done some background on how and why we collect immunization rates, I'll now go through the Childcare Survey and what that entails. Hopefully this helps answer some questions you all may have on the immunization reporting process. The first page of the survey is just asking questions about who is filling out the survey. So we ask for name, job title, phone number, and email address. Then we ask you to select your childcare facility in the drop-down menu. This menu separates the facilities by county name and everything is alphabetized, so they should be a lot easier to find than from before. If you do not see your childcare facility listed on here, there is an option to write in your childcare name if you select Other at the bottom of the drop-down box. You then fill in your facility's address, city, and zip code. At this point, you'll get to the vaccine questions themselves. Please note that when filling out this survey, it is asking you to report up-to-date vaccine numbers as of September 1st, 2023, or the current year that you're in. We try to align this with the beginning of the school year since we ask the schools to fill out a similar survey. So even if you are filling out this survey the following year, please report those vaccine numbers as of 2023, or it's usually in the fall of every year. So the first set of questions are concerning enrollment, which are numbers 1 through 1D. Question 1 is asking how many total children you have enrolled in the childcare facility. So that one's pretty straightforward. The next few questions will be asking for enrollment numbers for specific age groups that coincide with the minimum dosing vaccine requirement. The first one is specifically asking how many children you have enrolled between the ages of 6 months through 12 months. The next one is enrollment numbers ages 12 through 17 months, then 18 months up to 3 years and 11 months of age. And the last one asks how many 4-year-old children are enrolled. Again, we want the specific age enrollment numbers here because these align with the ages that are required for kids to be vaccinated, so that we have something to compare against when we calculate up-to-date percentages in each of the facilities. All of these ages would be as of September 1st. So if you're filling out the survey a little later, you may have to go back and double check what ages the children were at that specific time. So the next set of questions on the survey will all be asking how many children in each of those age groups had X amount of doses of each vaccine at that age. We tried to make these questions very clear, and we put the actual amount of doses for each vaccine that the child would need in order to be counted in these questions. If certain children did not have X amount of doses per each vaccine, please don't count them in these specific questions. And I'll just go over a couple of examples here so that you can see how to answer them. Starting at question 2, we begin with questions from the youngest age group, which is 6 months through 12 months of age. The first question asks, of the children enrolled from 6 months through 12 months of age, how many received 3 doses of hepatitis B by 6 months, 30 days old? Remember earlier how I mentioned that children need to get vaccinated at the youngest recommended age in order to enroll in a childcare facility? This is where that's going to come in. So that's why we phrase it like 6 months, 30 days old, because of that 30-day window I mentioned earlier. So you'll notice the next question is the same age group, but with a different vaccine, polio. Please ensure to only count the children who are up to date with the proper doses at the correct age that the question is asking. The next 5 questions are all for the 12-month through 17-month age group, and each question asks about coverage for a different vaccine. For this age group, we ask for up-to-date numbers for Hib, PCV13, MMR, varicella, and hepatitis A. Please answer these the same way you did the above questions, with noting which children received X amount of doses by 12 months and 30 days old. This slide is showing a continuation of the survey questions. Question 9 is for 15 to 17 months of age and asks for up-to-date numbers for DTaP. The following question, number 10, is for 18 months up to 4 years of age and asks for up-to-date numbers for hepatitis A. There is only one question for each of these age groups. The next set of questions, numbers 11 through 14, are the last set of questions for the 4-year-old age group. There are 4 of these questions, and they ask for up-to-date numbers for DTaP, polio, MMR, and varicella. Please answer all of these the same way you answered the previous questions. We are almost to the end of the survey, so hang tight. Now that we got through all of the up-to-date vaccine questions, the next part of the survey is asking about medical and religious exemptions, which you'll notice are on the right column on this slide. First, we ask for the total number of children who have any medical exemptions. We then get to vaccine-specific medical exemptions. The reason we ask for vaccine-specific medical exemptions is because certain medical exemptions are only for 1 or 2 vaccines, not necessarily all childhood vaccines. So we just want to know here specifically the amount of medical exemptions for each vaccine. The next couple of questions ask about religious exemptions, which are questions 16 and 16A. For number 16, we just want to know how many children in the facility have a religious exemption from any of the required vaccines. The next question, for 16A, asks if all of the religious exemptions you have include all required vaccines. In other words, does each religious exemption that you have on file for your facility include exemptions for all vaccines required for childcare? If you answer no, there will be a preceding question asking you to state how many of those religious exemptions do not include all vaccines, and to list which vaccines are not included in that exemption. Now we're down to the final 2 questions of the survey. Number 17 asks for how many children between ages 6 months through 4 years and 11 months of age are considered conditionally enrolled. And again, this means that the child does not have the required immunizations due to the minimum age requirements and or dose intervals, but they're in the process of completing this series of shots. The final question here is just giving you the option to ask about any questions about childcare, immunization requirements, or anything else about childhood vaccines if you are unclear on anything. And if you don't have any questions, you can just put NA here. So that is the entire childcare immunization rate reporting survey. Depending on your facility size, this can take some time, so please make sure to give yourself enough time between when the survey opens up in October to the end of December when it's due. Please don't hesitate to reach out to myself. My email is here on this slide, and I'm happy to walk you through anything or clarify any questions that you may have. In addition, if you have made it this far in the training, please send me an email with one thing you learned while watching today's presentation. This doesn't have to be anything too big, but maybe just 1 or 2 small things that maybe you didn't know before today. Thank you so much for listening. And here's a quick acronym slide for some terms I discussed today that you may have questions about. So feel free to screenshot this or pause the training here to take note of these. Thanks.